It is a big week for students all across San Antonio and Bexar County, heading back to the classroom for the first time, sometime for the first time since March of last year amid this pandemic. All of this happening a new school year amid concerns about surging cases of the Delta variant. And this is happening, affecting students at all levels. We have someone from Trinity University with us here today, Tess Coody-Anders, the Vice President for Strategic Communications and Marketing at Trinity University. We talk a lot, Tess, about elementary students, middle schoolers, high schoolers. Colleges are also making some tough decisions about how to safely welcome students back on campus. So talk to us about move-in day, which is coming up in just a few days at the end of this week. But let's start with masking. What are the mask requirements going to be for Trinity?
Yeah, you're right. And there's some special, there's a special situation for a college campus like ours where we're primarily residential. So we think of Trinity as sort of a small town where people are living, working, learning, and playing together. So there's really no going home and getting away from it entirely at night. And so because we live in that congregate setting, we have to take some extra precautions in order to mitigate the potential for spread of the virus in our small community. And so at Trinity, for example, we've achieved a 90% vaccination rate on our campus, which is incredible. But given the high transmission of the Delta variant in our greater community, we're having to take some extra behavioral steps, like wearing masks indoors at all times, whether you're vaccinated or not, and a number of other measures intended to help us get everybody back safely, sort of figure out what's going on with the virus in our population as we return, and then try to stop the spread.
Now, the things that you have in place for the start of school, not necessarily something that'll be in place the entire school year. You're kind of taking this on a wait and see approach.
That's right. That's right. We hope, I think, as do many of our epidemiologists and clinicians, that this surge will peak in mid-September, and we'll able to sort of dial back some of our protocols. We think about our COVID protocols as being not a light switch, but sort of on a dial or a continuum. And so what we've said is through mid-September, we're going to do some extra testing. We're going to take some extra steps around the mask wearing indoors. We're going to limit large gatherings indoors so that we have less opportunity for this virus to get a toehold. And then once we get to about we'll watch our testing and our positivity rate every week. And once we get to about mid-September, we feel we'll be able to make a determination about what, if any, of those changes or protocols continue.
Let's talk about vaccinations. We've seen some universities beginning to require their students to be vaccinated for COVID. You mentioned that Trinity has a 90% vaccination rate at this point, but is a vaccine requirement something the university is looking at?
It's really not. First of all, we're sensitive to the orders of the governor, and there is an executive order that prohibits universities like ours that accept state funds from mandating a vaccine in order to receive services, academic services and residential services. So it's really not even an option for us. That being said, we're fortunate that our community, the Trinity community, is achieved a 90% vaccination rate without a mandate, which is often we're finding better than even in some states where there are schools that can mandate the vaccine. So despite not having a mandate, our community responded, and we're really proud of that.
Will there be places on campus where students can get vaccines if they want them, and for testing and all of that?
Absolutely. So we've expanded our health services team to include a COVID health team that is organized specifically to respond to testing, contact tracing, and treating of students. And that's left room for our traditional health services team to administer vaccines, and now to also administer booster shots, third shots of Pfizer and Moderna to those members of our community who may be immune compromised and really are, in need of that now. So whether you've only started your course of treatment and need your second shot, or you need a booster shot, or you need a first shot, we can do that on campus. We're providing both the Pfizer and the Janssen vaccine to students, faculty, and staff.
You know, this last 18 months has been a gigantic learning curve for all of us, whether it be companies or campuses. So I would imagine there are things that Trinity learned over this pandemic that you all may be implementing in this new school year. Are there any of those learning lessons that you hope to carry over?
You know, I think one, the overarching lesson we've learned, whether we're talking about students, faculty, or staff, is that COVID and all the attendant protocols and concerns and extra steps we've had to take, and the distance from each other, the remoteness of what we're doing, has taken a really significant toll on people mentally and emotionally. And again, that's regardless of whether you're a parent with small children, whether you're a student. That's something we're really watching carefully and looking for ways to support each other, because it just is not ending. And that is, it's just whiplash. So that's a big learning. It's just that we have to pay as much attention to our mental health and well-being as we do our physical health and safety.
Real quick, we're running out of time. I just want to ask a question. If this surge gets worse, are you guys nimble enough to be able to go to online learning if it calls for that?
That was the second thing I was going to say we learned, and that is, fortunately or unfortunately, we don't have a scramble to move to remote or hybrid learning if we had to, which is an absolute last resort. We think because of our testing, tracing, and treating protocols and our high vaccination rate, that won't be a necessity for us. But I've also learned to be humble and never say never in this pandemic. So we're ready if we have to be.
All right.
Tess Coody-Anders, thanks so much for being here. I wish you guys all the best of luck with move-in on Friday and through the weekend and in the coming school year.
Thank you. Be safe, be well.
Thank you.
We'll be right back.